Hi, welcome back to Men's World Today. Today we're here with Dr. Nadia, a GP and an aesthetics doctor. And today we're talking about aesthetics. So, Dr. Nadia,
Hello.
tell us a bit more about the aesthetics.
Essentially, aesthetics or cosmetic
Right.
procedures or medicine, it's nature and appreciation of beauty. So
Right.
when people think of aesthetics, they think of anti-wrinkle treatments. So for example, everyone knows about Botox. Everyone's heard about Botox. Or things like fillers, dermal fillers, and in between things that like skin boosters. And mainly this is facial. So it's something called facial rejuvenation. So that means enhancing what you've already got, refreshing the way you look, and in general, whether it's men or women, boosting your confidence and making you look the best and feel the best. And for men, it's becoming more and more popular.
What sort of age groups of people generally go for this treatment?
So for women, it's a big range.
Right, okay.
And it also depends on what they're after. What are their
Right,
concerns?
okay.
So usually you get the younger age group who, when I say younger, I mean say from their 20s,
Right.
who want to say, for example, the most popular one would be the lips.
Okay.
It won't be so much because they've got wrinkles yet. And aesthetically speaking, we start aging from our 30s. And what that means is that we start to lose the things like collagen, elastin, and hyaluronic acid that's naturally found in our face, in our skin, even in our eyeballs and our bones. That starts to reduce as we get older. We frown. It doesn't spring back like it used to when we were in our 20s because of the loss of elastin and collagen and everything else I said. We also lose bone volume in our body. So, for example, when we're elderly, it's the reason why we get shorter. Is because the bones in our vertebrae get smaller because we're losing bone density, bone volume. So the same thing happens in our face. Our skull shrinks. So we lose the volume in our face. So everything that used to be like the scaffolding that would hold our face nice and up and high, and we had lovely cheekbones, and we looked really young, starts to decrease as we get older, and therefore we lose volume. So on top of that, gravity takes over, and that starts to pull everything down. So it depends on what age and what your concerns are. So answering your question, in your 20s, it's usually things like lips, because they want to enhance their lips. And as they get from their 30s to their 40s, it's because, say, for example, relax the lines that they have in their forehead, or what we call the 11s in the frown, or the crow's feet, which is your eyes. You start to have lots of volume in the cheeks. So you start to say it. So before it used to be nice and high, they start to get the lines, the laughing lines that they call. And even older than that, you start to get the jowling. So it's sort of like gravity pulls it down. And the same thing happens to men.
Yeah.
We're all the same instead of like in our anatomy. So men get lines, men will have loss of volume. And men also care about how they look, about their appearance, and why not?
That's very interesting, and I'm glad to hear that. So, like, what part of the face is commonly subject to aesthetic treatment?
Let's say the most popular aesthetic treatment, for whether it's men or women, is the anti-wrinkle.
Right. Okay.
You call it injectables because it's an injection.
Right. Okay.
So now it's like 1 in 5 appointments are men.
Okay.
That's quite interesting.
That's positive.
Yeah, exactly.
So guys, we can do it.
You can do it, and you should do it if you want to. There's nothing wrong with it.
Yeah.
I mean, but saying that, for me personally, I want everyone to have natural results.
Yes.
So whether you're a man or a woman, you want to look like you slept for about 3 months and you've been to the Bahamas. You don't want to look like, say, you've been done.
Yes.
But then there are some people who do want to look like that. So it's each individual, each to their own. For men, though, if you're going to talk about other treatments, would be fillers. And fillers are essentially hyaluronic acid. So it's like a gel that's like I said earlier, it's naturally found in your body.
Okay.
What it does is fills in that volume loss that I was talking about.
Yes.
And usually it's things in the jawline. Because you lose the bone volume, you don't have a chisel jaw anymore, or you're starting to lose your chin, and so you start to fill it up with the dermal fillers. So that for men it would be mostly the lower face rather than anything else. But then again, individual. Some men would like to have higher cheekbones, or would like to have enhanced cheekbones. It really depends. Well, for example, fillers for the lips will be completely different from the fillers in the jaw. Because what you're trying to do is replicate, for example, in the jaw, is the bone. So it has to be a harder filler, for example, in layman's terms, than it would be if you're using it in the lips, because you don't want your lips feeling like your jaw.
What techniques do you use? What products do you use, for example?
I mean, essentially everyone uses the same product because it's either going to be an anti-wrinkle treatment, which is what we call it relaxes the muscle.
Right. Okay.
So Botox is a brand, for example. So there are other brands, but they all do the same thing in the sense of they relax the muscle. So when you frown, contracts muscle.
Yes.
So then when you're contracting your muscle, you're forming the lines because the loss of the elastin and hyaluronic acid and collagen means that they don't spring back anymore. Relax those muscles, you smooth out the lines. You won't get rid of existing lines, but it will smooth it out. So fillers, like I said, is made out of a gel. And they don't have anything to do with muscle contraction in the sense that they don't relax it. What they do is fill out that volume loss. And again, there are other brands. So each brand will have a different name, but they'll be made of the same thing. So I don't just look at one area and go, well, okay, right, you just need that. It's about you. It's about you, your face. So if you came to me, for example, I'm not saying that you need to.
Well, I'm open to it.
Then you would be different from the next person.
Yes, of course.
There's not one fits all. And for me, it's an art. I love it. I'm passionate about it. I look at it as sculpting, and it's just enhancing what you've already got and making it look like you slept for 3 months.
Yeah. So it's very much a case of somebody comes to you and says, okay, I think I need something.
Which is why the consultation is like the most important thing. So, I spent at least 30 minutes having a consultation.
Okay.
So if someone comes to me and says, I want this done, they might not realise that's not exactly what they need doing. Make sure you go to someone who's medically qualified.
Absolutely.
Okay. Unfortunately, it's not regulated here yet.
It's not regulated.
Not in the UK. Everywhere else, it's regulated in the world, but not here. So they are trying to regulate things.
Right.
I think what makes me unique in a sense is that I'm a practicing doctor as well as a practicing aesthetic doctor.
There you go,
so
guys.
I look at the whole thing as a holistic approach.
And we like the word holistic at Men's World. We like to take a holistic approach to life. How long does a treatment last on average, or does it all depend on how much?
On average, 3 to 4 months.
Okay.
But it can last less. Say, for example, if you're someone who's quite active, you like to exercise because you're going to metabolize it quicker.
Is there any side effects?
Yeah, like everything. Nothing is free of any sort of adverse effects. So, that's why you need to go to someone who knows what they're talking about, who's someone's medically qualified. Side effects, for example, that it's under treatment. So, for example, if you do the anti-wrinkle injections, they might not work straight away. More serious side effects, it could cause visual disturbances if you get it in the wrong place, or if it's been injected, rather, in the wrong place. That's why it's important to go to someone who knows what they're doing.
Have you ever had to turn someone away? Have you?
Yes, definitely. I mean, I have. I've turned one because she was too young.
Okay.
And really didn't need anything.
Okay.
And she was so beautiful. She didn't need anything, and at the end of it all, she actually was just thankful because she felt that she was going to leave feeling more insecure. Because she thought I was going to say, look, you need this and you need that and more of this and that, and she was already insecure, which is why she was there.
Right.
And she said thank you, and I asked her why, and she said it's because of social media. I have turned people away because of mental health.
Okay.
So there's one thing that you need to look for is body dysmorphia. So that's when someone looks at themselves, in general, their physical appearance, differently from what you and I would see them. And that is an actual mental health condition. So it's not someone who thinks, oh, I just look fat, or I'm just not that good looking. It's someone who generally does see themselves completely differently, and no matter what you do, they will never be happy with it. And it will be, so you're not doing anything to help them as such, you're just feeding into that mental health, anxiety, or body dysmorphia.
I think the more I listen to you, the more I begin to appreciate the fact that you need to go to a professional. You can't just go to, because it's quite refreshing to hear you say you turn people away.
It's called being ethical.
That's the word I was looking for. Ethical aesthetics. Is there a particular time of year where people tend to go for aesthetic treatment?
Yes.
I mean, is it Christmas, hot summertime?
Right before Christmas.
Right before Christmas, right.
See, or summer. So it's usually, it takes about 2 to 3 weeks, for example, if you're going to do anti-wrinkle injections, to kick in. They do last an average 3 to 4 months. So people like to get it done right before Christmas.
Right.
You know, and some people just do it all the time.
Well, Dr. Nadia, thank you so much for coming and talking to us about this again. Guys, like I said, you know, we care about you. We want you to take care of yourselves, and we've had some very good advice from Dr. Nadia. If ever you're thinking of doing it, where are you actually based at the moment?
So I'm based in North and Northwest London.
Northwest London, okay.
Yeah, so you can find me.
If you want to get in touch with her, please do. At least have a consultation. And, you know, break taboos. If you want to get it done, get it done. Don't worry about what other people think. It's about what you think, how you feel at the end of the day. Well, thank you so much, Dr. Nadia.
Welcome, thank you.
It's been such a refreshing, pleasant occasion. We hope you to visit us again soon.
Thank you. So do I. Thank you.
Thank you very much. Well, guys, we hope you enjoyed this session on aesthetics. And if you did, please like and share. And until next time, have a beautiful day.